The rising COVID-19 infections have put health workers in the spotlight, with growing concern over their safety and welfare. But despite the tough working conditions, many of them continue to put in the long hours with their lives on the line so as to keep the pandemic at bay. Tonight, Maryanne Nyambura speaks to two medics on the highs and lows of the relentless war against an invisible enemy.
9 months since the first case of coronavirus was reported in the country, the Ministry of Health has termed November as the worst month as cases continue to spiral out of control. Frontline workers bearing the brunt of the pandemic, with more than 2,200 infected. 30 of them have succumbed to the virus, among them 10 specialists. Joseph Njehia, a nursing officer at the Nakuru Level 5 Hospital I-Unit Department, knows too well the challenges that medics face at the COVID-19 battle room. Having tested positive for the virus while on duty and being hospitalized for 6 days, Joseph counts himself lucky after such a terrible ordeal that put his young family at a risk.
For any condition, when it is disclosed to you that you are suffering from this, it is very traumatizing. My first worry was my daughter. We have gotten this daughter after 15 years of marriage.
The COVID-19 battle, experts say, is far from over. And while healthcare workers such as Joseph Njehia continue to put their lives on the line, the harrowing experience has left them battling stigma. The months of July and August have been terrifying for Stephen Kibuku and his family of 3. As a private practitioner in Nakuru town, the exposure to the virus led him to self-isolate at home for a record 3 times during the 2 months. His wife too was hospitalized and put on oxygen supply during the same month. Her worst fears of being away from her children played out.
Went into self-isolation. Unfortunately for her, the situation was that we have a small baby who is lactating. The baby is breastfeeding. The baby is 12 months old. So it became difficult to separate mother and child, but up to the point that she had not developed any other symptoms, she continued to breastfeed, and she would breastfeed wearing a mask, breastfeed and limit the duration of time she's spending with the child.
Whereas many medics in other counties who contact the virus have no access to medical health cover and have been forced to foot the hospital bills, it is a different story in Nakuru that is covering the cost for its healthcare workers. The county has set aside a 64-bed capacity isolation center at the Nakuru Annex Hospital, prioritizing the healthcare workers and treating them for free.
Luckily, we have not lost any health worker in Nakuru County to COVID, but we have admitted many and discharged many.
Stephen and Joseph represent a fraction of the medical workers who have gone to great lengths to save the lives of those who find themselves infected. But the clarion call to Kenyans during this time is to continue adhering to containment measures to contain the spread. Maryanne Nyambura, Citizen TV.